Welcome again to this special edition of Mikey Live. I'm happy that you took the invitation to be here with us today. And we've been having a series of programs talking to the various stakeholders to find out how the COVID-19 has affected or is affecting their industry, how they're involved in the response and fight against the current outbreak of COVID-19. And tonight we are pleased to have with us the chairman of the Grenada Tourism Authority, Mr. Barry Collymore, and as well we have the president of the Grenada Hotel and Tourism Association, Mr. Leo Garbott. Gentlemen, welcome to tonight's program.
Thank you, Mikey.
Good to be with you, Mikey.
Good evening to everyone. Hi, Leo.
Hey, good to see you all. And thanks very much for the invitation. And I'm very glad to be here with all of your viewers and listeners.
All right, again, it's a pleasure to have you two with us tonight. Now, this is a very important discussion for us here on Mikey Live. We've been speaking to various stakeholders, and we realize that people are really being affected significantly by this COVID-19, and sometimes we do not really know what it is like for them and their industry if we don't hear it from them. And so we are happy to have you to hear it from you. And there is no doubt that the tourism industry is one of the main pillars of our economy, and it is being affected by COVID-19. In your view, and we will probably start with Barry, how significant are those effects and where are they most visible?
Well, thank you, Mikey. It's a great question, and I just want to say that firstly, your comment about tourism being one of the main pillars of the economy is exactly correct. There keeps being this debate about tourism versus agriculture, and people are saying, "Oh, we shouldn't have abandoned agriculture," and the lesson is we didn't. Tourism is the greatest market for our agriculture. So I want people to understand that, firstly, that one of the sectors that is feeling this the most is the agricultural sector and the fishing sector, because our local farmers and our local fishermen, their market is the hotels. So, I mean, Leo, the amount of produce that you buy locally at Calabash, and this goes for all of the hotels. The tourism industry is the biggest market for our agriculture, and then I want to also say that where is it visible is in the revenues of the country and the impact that it has on jobs. There are thousands of people right now who are either unemployed or underemployed because of the slowdown in the tourism sector. So it impacts other sectors like agriculture and fishing, and there's a definite impact on jobs and revenues coming into the country.
All right, thank you for that response, Barry. Leo, what do you have to say about that?
Well, actually, when it comes down to it, we've had a good year in 2019. And when it comes to that, if we take that as the base, the revenues fell from 2019 to 2020 by 76%. So when you get a fall like that, everything suffers. Because if you look at Grenada as a business, it needs an income and it's then got the expenditure. So if your income is high, your expenditure can be high, and you have to track back if your sales go down. Now, it's obvious that the revenue has gone down by 76%. So that means that there's a lot of difficulties when it comes to the employment side of things. And actually, the sad thing about that is that our team members are hit directly in their pockets. And that is devastating, because we all need people to expand and get better at what they do. That's the natural thing in life. We've now going to go through 2 years whereby we're going backwards, because I would imagine the revenues for 2021, by the time we finish, are going to be very similar to what they were in 2020.
Wow.
So we've all been hit, everyone in the country and everybody in the world. Also, tourism is the world's biggest industry. So therefore, we've all been hit. The whole world has been hit, so we're not unique in that. The sad thing about our situation is that everybody's been hit in their own pockets.
And you know, the tourism industry itself, I have had friends and associates who have given me an idea as to how it impacts them personally and their families, and it's really heartbreaking. Now, Leo, how would you describe the state of the hospitality industry right now?
Actually, quite honestly, we're treading water, because we're all trying to get out of this. One of the things that we all are in the hospitality industry is that we're always thinking of the future and thinking about guests coming in. We went through a long period in 2020 where we didn't have any guests because the borders were closed. The industry as it is now, to my mind, we were on the way up, and because we needed to. And what has happened when you look at the fact that the borders are open, our government have been very sensible in the respect of keeping the borders open, because we closed the borders, and we closed the borders to keep COVID out. COVID is here, so there's no sense in closing the borders, and there's no sense in locking down in any way, shape or form. So when it comes to the industry that it is at the moment, we have got to think about the future. We've got to think about how we get out of this. In actual fact, we can get out of it, and we will get out of it by strong leadership.
And that's words of affirmation, making sure that we speak it out there, and I know that it can happen. Now, Barry, speaking about the future, as a chairman of the GTA, what are the priorities for Grenada regarding tourism and hospitality?
Well, certainly the priorities are unchanged. We have charted a path to success, and despite what is happening now, we have tweaked those plans, but we are continuing to implement those plans. So this is the phase now for planning and preparation, not panic. And that's what we are doing. We have assembled probably the Caribbean's best marketing team, led by our new CEO. Well, she's not so new anymore, Petra Roach. We are putting Grenada out there in markets and in ways that we've never done before. And just leading up to this particular bump in the road that we're seeing with our first COVID wave, Grenada had a number of achievements this year. This year, we were one of the few countries who got on the UK green list. That had a lot to do with the management of COVID, and also the extensive lobbying and marketing done by the GTA, and the management of COVID by the local officials. We had a really good start. A few months ago, hotels, in fact, there are hotels now running at 90%, even now. So we had a good start, and we will continue to on that path. We have a particular difficulty right now, but we'll get through this. Another big achievement that we've had is Grenada is now one of the few countries that will host the upcoming England series. If that is not a test series, if that is not a testament to to confidence in the country. I don't know what is. So that, when everybody was saying, oh, we might be red listed, I never thought we would be red listed. We're not going to be, a test venue for one of the biggest England series for early next year is not going to be red listed. So, we have a lot of work to do. We have our marketing platform that we've launched. We continue to refine our protocols. I expect we had a meeting today where we looked at, I don't know if you know it, but Grenada has the toughest protocols in the Caribbean. There's nobody with tougher protocols than ours. And we looked at some of those protocols and not necessarily changing them, but changing the way in which they're implemented to make it easier on the visitor. And we have to do other things in the sector, but the main thing right now is to stay the course. We have to plan, and we have to keep getting Grenada's name out there. We just had Grenada's name out there in several UK publications. And fantastic press, not generated by any other Caribbean island. So, we have to continue on course, and we must not be daunted by what is happening now.
And I know Grenada has been struggling nationally where it comes to vaccination and so on, but the hotel and hospitality industry has been leading the way with the vaccination uptake, almost 100% within the sector. What would you say is responsible for that?
I should answer that, Barry.
Yeah.
Actually, there's a good thing when it comes to the way we work together. The Hotel Association is an independent body, and we work very closely. We're in the private sector, and we work with the public sector through GTA. Now, when we were talking about things and we were talking about how we go forward, what we wanted to do was to make sure that we created an atmosphere within our hotels where people were comfortable and that they could come to a comfortable environment. Now, think about this. Think about the fact that you're a visitor and you're thinking of going somewhere in the world, and it's COVID-19. So as a visitor, you think, where can I go that I know everybody who I'm going to meet is another tourist who is fully vaccinated? But before that, what we did, and actually it was a very strategic plan, was to get all of our team members fully vaccinated. Now, what that has done within all of our hotels, it's created an atmosphere where people are happy to come to work because they know that everyone that they're dealing with is vaccinated. All of their colleagues are vaccinated. So that's stage one. Stage two, we then said only fully vaccinated visitors could come to Grenada. What that has done is created an enclave, and we are, with all of our hotels, we've got enclaves. And as Barry said, we were the first in the world to do this. The first in the Caribbean to do this. And actually, not many people have followed us, but I'm glad to say that Antigua has followed us just yesterday, and they have come in with the situation. So they are thinking like us, that we need to get to the guests. So how do we get to the guests? How do we make them feel really good? Tell them that everybody here that they come into contact with is fully vaccinated. And that's worked. And that's one of the reasons why I'm fully confident that when it comes to the future, future bookings are going to come in very, very strongly. At the moment, we've got a bump in the road, and our reputation when it comes to the take-up locally of vaccine is very, very low. But, however, I get the impression that people are listening now. I understand they don't want to be lectured, and we don't want to lecture them. But actually, we're a team here in Grenada, and what we need to do is to work together. So come on, let's all be together. Let's beat this COVID-19, and we can.
And we will.
We definitely will.
Okay, I know. Barry, you wanted to come in here? Okay, go ahead.
Yeah, a few weeks ago, I had one of my friends in Jamaica. They were having a spike at that time, and I was saying, "Boy, I'm really sorry that y'all are having a spike." And he said, "What spike?" I said, "You having a spike?" He says, "Well, we having a spike." He said, "But you know what? We got vaccinated." He said, "My hotel is fully vaccinated, and I'm back to full salary, and we are doing better than we've ever done." And he's saying as well, he said, and we've actually employed more people. So, when you look at Grenada, you look at the business closures. Where have the businesses closed? The retail and some parts of the service sector. Hotels haven't closed. St. George's University hasn't closed. Why? Vaccinations.
Ah, okay. Now, COVID-19 has brought with it a high level of job insecurity. How is it being addressed with your staff, Leo, and management team?
Actually, one of the things that we've all got to do is to make sure that we never be in a situation of being depressed, because the people pick that up. Yes, we're going through tough times, but heavens above, we've been through tough times before. In 9/11, we've had the hurricanes. They were pretty serious. 9/11 was pretty serious because people didn't travel. We've also been through the financial crisis, and up to this point, I thought the financial crisis was the worst situation that we could ever go through. We've got through all of those, and we're resilient people, and we will get through this as well. But then the reason we're going to get through it is by taking sensible steps and making sure that we manage things correctly, and we manage to give hope to all of our team members. Yes, it's a bit of a tough time at the moment, but we're going to get through it, and we will. And they know that. And actually, there's a history there of us getting through it. We'll never give up, and because we're resilient people. And that's a great thing about Grenada. We are really resilient.
Yes, we are. Barry, what is your assessment of Grenada's COVID-19 management as it relates to tourism and travel?
I think that Grenada did very well in terms of keeping the case numbers low. I think we have not done as well in terms of vaccination. And vaccination really is the only solution to get us out of this. But we've done well in terms of managing the crisis. It is unfortunate that other countries, we have delayed our first wave. Everybody else had a first wave, and we are now going through our first wave. And what's unfortunate about that is that we are going through our first wave with the most virulent, most infectious mutation of the COVID-19 virus. So that's the real problem, and that's a concern, and certainly people getting seriously ill and dying. It's a tragedy. It's so sad, and I've known many people who have been very sick, and I've heard the stories. But I also know many people who have been sick and who have been vaccinated who didn't even really feel sick when they got the COVID. So, we've managed it well. We have to get our vaccination numbers up, and we have to get the problem in the Caribbean is that we have a adversity to public health and preventative health. So we'd only go to the doctor when we are very, very ill or feel like we're dying. We don't do any checks. We don't do any preventative care. And that's the problem, I think, with the vaccine uptake. People never felt that they needed it because they never felt that they were dying, or they never felt that they were seriously ill. And you see the same thing with the non-communicable disease pandemic that the Caribbean is facing. Nobody takes it seriously. People don't exercise. They don't eat properly because they're not interested in preventative medicine. And the same thing with the vaccine. Unless somebody's really, really ill, they're not thinking about the vaccine. So we have to do a better job of being healthy and looking after our health and well-being, and this calls for a multi-sectoral approach. Not just the government and so on, but all the businesses and community leaders, the unions, the churches, everyone come on board to make us a healthier society. And the vaccine having your up-to-date regimen of vaccines is part of being healthy.
Well said. Now, Barry, this period calls for, among other things, leadership and innovation. What other areas do you think needs to be strengthened in order for the industry and Grenada to thrive?
I think that we need to do a lot more linkages with our with entrepreneurship and tourism. I think there are a lot of goods and services that I don't think that we do as well a job in terms of getting people to spend money here outside of the hotels. And I think there's opportunity now with the technology for young people to get involved in the tourism industry and get connected with, and don't just see tourism as hotels. It's not just the hotels actually want visitors to go out there and enjoy and immerse themselves in the experience of Grenada. So that is one where I think entrepreneurs have to get more involved with the hotel sector. The other thing that I think that we need to do in terms of leadership and innovation is that we need to have a better trained workforce, and we are trying to do that with the West Indies School of Hospitality. There's been tremendous sign-on and sign-up from in participation from the hotel and service sector, which I think having a more competitive and better trained workforce empowers people, makes them feel better. They earn a better wage. They get more. You get more revenue because, if I can serve, if my customer service attitude allows me to serve 3 or 4 drinks, or a full course dessert, main and appetizer, you make more money, you make more tips, everybody's more profitable. So, and then also the training leads to more entrepreneurship. So I think that those are the 2 areas that I think that we need to look at more closely, but we also need to look at the community linkages and how we can link the communities more into. Grenada has a fantastic story, and it's got a tremendously energetic and creative young population, and that we need to ensure that young population gets more involved with tourism. We have already started it. We already stopped all of these foreign big ticket, high-end TV crews from coming in and doing stuff for the GTA. We are sourcing all of our content locally, and I think that's a big step.
All right. Leo, you wanted to jump in here?
Yeah, I do. Actually, when it comes down to it, when you talk about leadership, we've got to think through what has happened. You were talking in the previous question about COVID-19 and our handling on it. There was tremendous leadership there, because from March 2020, when COVID-19 first started, all the way through to August 2021, we were leaders in the Caribbean. And then in August 2021, the numbers jumped from 664 cases and 1 death to the situation now whereby we've, within basically 2 months, to 3,262 and 46 deaths. Actually, that's a huge spike. And what has happened throughout the world, that is the same thing happens. That there's a spike, the medical people get involved with it at the top of the spike, they deal with it, and it comes down, and then we move forward. So we have got a good position where it was managed previously, and it will be managed again. When it comes down to the leadership within the industry and how our industry can thrive, we need to work together very closely with GTA, and we do. We also need to work closely with the Chamber of Commerce, the unions, the medical association. We need doctors' help as much as we can possibly do. I saw on the post-cabinet briefing that our Minister of Health was saying that we have got one of the highest population of doctors per capita in the Caribbean. Actually, those doctors can help us, and they can help us with the management of the situation we're doing here. Also, when it comes to the management of the government, we work extremely closely with the Minister of Tourism and the Minister of Health. And I must say that when it comes to their leadership and the leadership of the Prime Minister, all three of them are always available to talk and to guide us through this. So when it comes to leadership and the way that we can improve our industry, it's the same as we can improve everything in the country.
All right. And just as we get ready to wrap up, I'll ask both of you this question. What has COVID, and we'll start with you, Leo, what has COVID-19 taught you about tourism in general, but Grenada in particular?
Actually, let me broaden that, because I want to say that up to 2019, life was really good. And we had a really good in Grenada, and things were on the way up. And actually, can you remember when it was nice to go to a family gathering and not worry about how many people were there? People could go to church, they could go to restaurants, they could go to bars, you could go to the beach, you could go to plays, and you could go to nightclubs, you could travel on a plane. You could go to a supermarket without worrying about how many people were in the supermarket. And what we need is life back as it was in 2019. So what we need to do is to get vaccinated, and life will go back. In Sweden, they are saying that life is back to normal because so many people are vaccinated. It's the same in the UK, that so many people are vaccinated. And therefore, what I would like in general is life back to normal. So that's my wish. And actually, with all of us together, we can do it.
All right. Well said, Leo. Barry?
I think it's taught a lot. It's taught us a lot. It's taught us certainly that we need to pay better attention to our individual health. We need to live healthier lifestyles. Some of the excesses that we engaged in before COVID, I think we need to take a check of our own selves, and so that we are there for our families and our children. I think we really need to look at someone's health is the most important thing, because without your health, you really don't have anything. So I think if it is one thing that it has taught us, is that we really need to pay close attention to our health. As Leo mentioned, we went through some really good times post pre-pandemic, but I believe that we have better times to come post-pandemic. I think that one of the things that it will teach us is another lesson in resiliency, that we can come out stronger after a crisis and more united. And I think that it will drive innovation, and people will reinvent themselves in ways that they never thought, and people will come out stronger and better than they ever thought. I don't see it as going back to normal. I think that there will be a new normal where we can actually, and Leo and I have discussed this many times, we can actually become, in the Caribbean, and Grenada being a big part of this, we can become one of the tourism and international business leaders in the region and the world if we do things right. I really believe that, because I think people have seen how we've managed COVID. I think that they have seen, which is very well. Yes, we're having a tough time now, but up to now we've managed it well. And not only that, I think that with the creativity and ingenuity of our people in the region, Grenada region in general, I think that, um, and the lessons that we would have learned, I think that we can come out stronger. But the decisions that we make right now are very, very important. So I think we need to make decisions. Every decision needs to be looked at, and I think the government. I agree with Leo. The government and some parts of the private sector have done a tremendous job in managing the situation. But we need to continue. We need to be more unified, and we need to realize one last thing. I'm sorry to be a little bit lengthy on this, but when you say your people are your greatest asset, this COVID-19 has shown you that. There's a finite number of policemen, doctors, nurses, stevedores, all of those skills. And if we have uh, death or debilitating sickness in any of those groups, it has a direct impact on the country. So we need to realize that um, as individuals, if I'm a policeman or I'm a nurse or I'm a doctor or whatever, and I'm acting irresponsibly, if 3 or 4 or 10 of my colleagues act in the same irresponsible way, I can have a devastating impact on the country. If we act responsibly, we can have a tremendously positive impact on the country. So that's what I would say. I'm hopeful. I'm positive. We are doing what we have to do, and I think we'll be all right.
All right. Leo, any final words before we wrap up?
Actually, Mikey, yeah, I've got a question for you. I saw your post last night that you've now been vaccinated. So I'm glad you've joined the party. And I thought the post that you put out there was just fantastic because actually, strangely enough, there is a good medical thing here behind what you have stated. I have seen that in a lot of places, and it's not been picked up by an awful lot of people. And when it comes down to thinking about the health of the nation, we need to have children coming along all the while. There's only one way that we can get children in Grenada, and we need to make sure that COVID-19 doesn't affect any gentleman in any particular way. So thanks very much, Mikey, for doing what you've done. And I would hope that from now on that all of your people look at your post from last night, because it's something that is very funny, as we're amused at the moment, but actually there's a serious issue behind that. So let's make sure that we've got the population of the country going in the right direction.
Barry?
Yeah. I was laughing so much at that post. Bro, what are we missing? Like, why do you think people aren't getting vaccinated and so on? What's happening, man?
I think from the onset, Barry, there's been a lot of skepticism, and sometimes when people don't understand things, they criticize it until they do, and so that is what is happening. And people generally don't like to be told what to do, and from the
Yes.
onset,
Yeah.
they were being told about taking their vaccine even before they understood what the vaccine was all about. So from the inception, and they say that the first impression is lasting one, right? And so from the first impression that they got about the vaccine, that is still a lingering perception about vaccines. The fact that it was not approved and all of that, you are still hearing that argument today. And so I think that's what's happening. It is just the first impression that is still lingering. But I believe that eventually persons will come to terms with the reality that we are experiencing now and make the right decision for themselves and their families.
Excellent.
Yeah. Yeah.
Actually,
I
they're
agree with
growing
that.
family, Mikey.
Say that again, Leo?
And making decisions for their growing family,
Yes, yes.
and
And
more children on the way.
And I thought about that too. That was part of my decision as well. What would my son say to me if he had to be taking a vaccine? If he could have spoken, what would he say? And he can't speak, and so I have to make a decision for him as well. And I thought that probably when you weigh the pros and the cons, I feel safer for myself and my family being vaccinated rather than taking a chance at it.
Yeah,
Yeah,
excellent.
yeah, I agree with that. I agree. I totally agree with that. And I think that, Leo, the messaging, sometimes is a little, sometimes people may perceive it as a little harsh, but it's not. I don't think that is they're harsh. I think that the people who are doing the messaging know that the emergency, that they know that this is going to get real. You know what I
Right.
mean? They know that. Look at what has happened in the last few weeks, right? These guys knew that this could happen, so they were like, let's push this thing because we don't want it to happen. And that's, it's it's sometimes it's a tough one.
And that's the thing, Barry. Again, being caught within a rock and a hard place. The decision makers, they understood and that there was a sensitivity here in terms of the timing and the time that we had. There was no time for fluffs or anything, and they thought that the best way to get the message across is just to be direct. And again, there
Yeah.
is a chance taking when you go so direct, in that you will get some sort of resistance, because again, people don't like to be told what to do. So what do? They decided to go hard, and then the people kind of push back at it. But honestly, I do think eventually people would start responding, as I have seen. I was one of those who were very skeptical as well, because I needed to get the information that I needed, and I tried in every angle. And then I made a decision. And I think while some may be slow to act, they will eventually act.
Yeah, I think it's a great thing that you did, especially publicizing it, because people, I think that, sometimes you need different people. You need to hear. The best recommendation is when somebody that you trust or that you know well says or does something. I think that's it.
Right. Well, gentlemen, this has been a really good discussion. I really enjoyed having you guys. It's a pleasure being among you, gentlemen. I honestly do feel honored. And so let's keep the conversation going. And I hope that we can meet up again in this way. That's what COVID has caused, but it's a positive thing that we are getting together now and continue the discussion in terms of Grenada's way forward and how COVID is affecting the tourism sector and the improvements that is along the way.
Excellent.
Thank you. Thanks, Mikey. Enjoy your lockdown.
Trust me, and I am.
Yeah. Actually, from my point of view, I think there is a phrase that we need to know, is that we're not safe until we're all safe. So that will help an awful lot.
Yes, it will. Yes, it will.
Good.
Well, thanks again, gentlemen. All right, and all the best to you.
Thanks, Mikey. Thanks, Barry.
Bye.
All right,
Good
all the
night.
best.
See you, Leo. Bye.
Bye now.
All right, ladies and gentlemen, so we've been talking with the chairman of the Grenada Tourism Authority, that's Mr. Barry Collymore, and the president of the Grenada Hotel and Tourism Association, Mr. Leo Gabot. And of course, we were just discussing the tourism industry, how it's been affected by COVID-19 and some of the challenges that they have and how they plan to overcome those challenges. And we need all hands on deck. All right, we need to get Grenada back to a place where we can all live comfortable again. And of course, the gentleman spoke of ways that we can do that. You have a part to play, and I hope that sooner rather than later you will. Thank you very much for watching, and see you guys at the top of the hour, 9 o'clock, where we'll be back with you for the Mikey Live News. So thanks again, and do expect more of these discussions right here on Mikey Live. Have a good one.